Tics and Tourette's syndrome, or tic disorder and Tourette syndrome, are very common in pediatric age group. So tic disorder is the catch-all term that we use. Tourette syndrome has a very specific definition. Generally, tic disorders are common in kids who are between ages 2 through 8, and they grow out of it. So we usually don't recommend treatment or anything like that. But if the symptoms kind of persist, then you might want to see a neurologist. Movement disorder specialists like myself and Dr. Butler, we are all trained in pediatric movement disorders as well. So what we usually do is we ask the family members what the exact way this is presenting. A video of the movements will be very helpful, because sometimes the child that is coming into the clinic might not have the tics or the movements, but mom or dad would have actually shot a video of it at home in their natural situation, right? Because sometimes these movements can be seizures that they didn't know were seizures, right? So we want to make sure that distinction is clear. Oftentimes tic disorders show up with either a facial tic or a body tic. And this happens when they're playing a video game or when they are engaged in something else. Sometimes this shows up as a disruption in class where they would blurt out something. We call it a vocal tic. That could be just a grunt, or sometimes even like a sort of a throat clearing noise, or sometimes even actual, an expletive sometimes even. Those are rare, by the way. So if you have those features and also you fulfill other criteria, for example, if you're a hyperactive kid, you have a diagnosis of ADHD, or you have obsessive compulsive disorder, then you're likely to have Tourette syndrome, which is the umbrella word used for tic disorder with other things. So you need to have some motor tics, the body tics. You need to have a vocal tic, and also have to have that disease for at least 6 months to a year or so. You should be also under the age of 18. The definition has changed a little bit. Some people might even get that to almost like pull it up to 26, age 26. Boys seem to be more affected than girls, very often, but these days we don't distinguish that. We just go for the treatment if this is disruptive. For example, if the child is disruptive at class, not because of ADD or ADHD, but because of vocal tics, this needs medication. The first step, obviously, is to see if there is anything psychological that is triggering this. There's a whole cognitive behavioral, treatment that we can offer. It's called CBIT. It's called Comprehensive Behavioral Intervention in TIC. It was developed by a bunch of neurologists, and now they are actually being implemented by different behavioral therapists around the country. You can buy CDs of this. You can go online and search for this CBIT in Tourette syndrome or tic disorder. So this trains you to divert a tic into something that is not obvious. For example, if the child is constantly jerking their head and then causing a problem in the class, they will teach the child to make that tic less obvious and less obtrusive, so that it actually doesn't intrude the class and make the whole class, look at the kid. Vocal tics are difficult to control. So in those cases, we might need to give them medication. So there are several levels of medications you can use. Some of them are very mild. Some of them are seizure medications that have been repurposed for tic disorder. There are some specific antipsychotic category of medications, and also we go for some high level medications that work in the dopamine system. We think that dopamine system, just like in Parkinson's disease, dopamine system seems to be involved in tics a little bit as well. So silencing dopamine as opposed to giving them more dopamine is the answer for tic disorder or Tourette syndrome. There are some patients who have Tourette syndrome with other features as well in their body. Oftentimes, if that is a child who is in their teens or later teens or early 20s, I might investigate for other disorders like genetic disorders as well. Tourette syndrome and tic disorder are very heavily seen in multiple members of the family. So there is a very heavy hereditary element to it. There are no 1 or 2 genes, but we know that clusters of genes can interact with each other and cause it. So we might interview the mom or the dad to see if they had anything like this when they were a child. 99% of tics, resolve. A small group of tics kind of hang around when the kid gets older. That's the kind of older kid that I might treat shortly for a short period of time to get them through that. For example, let's say I have kids who are in their high school years. Now the kid is moving out into the college, and then they're just joining college, and now the tics are worse because of the stress element. They want a medication for that, just kind of, to start that. by the first semester is over and they're for their fall break, they don't need any more of the medication, I'll tell them, hey, come and see me when you're back home, but you don't need the medication, I can take you off of it. Then let's say an exam comes in, or they start dating, and then suddenly the social anxiety and the friendship circle or whatever actually starts triggering their tics. I will give them medications for a short while again, but watching them how they interact with the medication, how their brains interact with the medication. If they feel like they're actually responding to it, I'll keep them on a shorter duration and then gradually taper it off. So most patients can go in and out of medications depending on how bad their tics are. They don't need lifelong treatment. In a small group of patients, when it becomes so disruptive that their head and body are jerking and they have muscle problems and things like that, that's when we go for advanced therapies.